Chronic or recurring ingrown toenails are things that a lot of people have to deal with, but fortunately there is a solution so you don't have to deal with this anymore. We're going to go over a technique called a chemical matrixectomy that stops the portion of the nail from returning so you never have to deal with this again. Before we start, we clean the toe well, and then we numb the toe with 2 small shots way back at the base of the toe so you don't have to feel anything up around the area where the toe is actually hurting. The first thing we do after that is to put a tourniquet on the toe. This keeps the toe from bleeding or bleeding very much, so we can not only take care of the nail but keep the chemical in place. Next, we make a small cut in the nail just to remove the portion of the nail that's causing the pain. We want to leave the most of the nail in place so cosmetically it looks as normal as it possibly can. We use a little splitter to separate the nail down under the skin so we don't have to do anything to cut the skin, and then we can just use a little freer to lift the offending portion of the nail out. Once that nail piece is removed, then we apply a chemical that is applied down to the base, or what's called the matrix of the nail, and this is what stops the nail from actually growing back again. And remember, the toe's completely numb, so you won't feel any of this at all, and so it looks kind of like a Q-tip, but we're just using a little cotton tip applicator to put a little chemical on there. Once we do that, we irrigate it or clean it off well. Next, we put a little antibiotic and a bandage on, and then once that's done, the tourniquet will get removed and the procedure is complete. Over time, the skin will heal along that edge. Typically, the skin will just reach the new edge of the toenail, and cosmetically, most people can't even tell a difference from where the toenail was removed.